This is CBS 6 News in high definition.
Well, it's a topic we've been following for months now, healthcare reform. Some drastic changes are on the horizon, and those who are making them were in Albany today. Representatives from 4 of the largest insurance companies spoke with hundreds of local business owners about how the Affordable Care Act will affect their employees. Our Jennifer Lukey sat in on the discussion.
So talking about healthcare reform.
Business owners and benefit managers from across the capital region filled the room full of questions about what kind of plans they'll be able to offer their employees come next year.
The health insurance is a big concern of ours. Throughout the years, we started trying to help the employees by having multiple plans, different deductibles, but that has all changed now with the new reforms and all that.
Chris Carmichael runs ALPIN HAUS and has been looking ahead for almost a full year now.
We actually started the first quarter of 2013 trying to look into what we're going to do in 2014.
Small businesses will now have the choice of entering their employees in the state's new healthcare exchanges, and some will get subsidies for doing so.
Smaller companies, the employees in those companies are going to have to make some decisions whether or not the employer decides to use the exchange or not. They're going to see some changes in their health care plans.
If your employer does decide to enter the exchange,
What we're doing with the exchanges is we're really taking the healthcare decisions really from the employer and putting more of the decision making in the hands of the employee.
but that also means you have to be a lot more attentive come open enrollment time.
Just keep talking to the carriers, to your brokers, reading as much as you can because it's changing daily. And so don't get upset that you don't understand it all, because I don't think anyone out there quite understands how it's all going to come together.
We're staffed for it, and we're ready with all the materials and everything we need to do in order to give people the information they need to make decisions.
Chris is still deciding what's best for his business and his companies.
In our business, cost is everything. So if they can, provide their families and maybe not have to pay as much and don't go to the hospital or health insurance, they're definitely going to go that route.
It's really hard for any of us to know what to expect because, as you just saw, a lot of the business owners, benefit managers, and the brokers are the ones who are supposed to answer our questions. They still don't have any answers, or at least not all the answers. Now, the state has put together a website where you can learn about these exchanges. It's called nystateofhealth.ny.com. We'll link you to that on our website. Come October 1st, when these exchanges go live, you'll use that same site to shop for and compare prices on plans in the exchange, Liz.
But right now, Jen, we're talking about people who work for small business. They're the ones who are going to be affected this year.
Right, Liz. If there are less than 50 employees at your work, you're going to see changes whether you like it or not. You may even be forced to enter into one of these group exchanges. The other folks who will surely be impacted here are those who currently have no insurance at all. You will have to buy insurance through the individual exchange, and the rates for that are actually looking fairly reasonable. It used to be if you just called up an insurance company and asked for coverage, you'd have to pay $1,100, $1,200 a month. In the exchange, the way the rates are set up right now, it looks like you can get a plan for between $300 and $400 a month.
All right, and I know we'll be following that over the time as more changes are implemented. Jen Lukey, thank you.